All right, everybody, welcome to our last episode of the Digital Trade Show today at the Profitable Dentist Practice Owner Conference. Very, very excited for our final guest. This was actually a very nice treat. Got a chance to meet Dr. Koerner earlier today, and really excited to have him come on and talk about all the things that he has done in regards to oral surgery education. We've got some really good questions for him that I think are going to be super helpful. But first off, welcome to the podcast.
Well, thanks, John. It's good to be here.
Yeah, I really, really appreciate it. And I know you've done so many things over the years in regards to teaching and educating in oral surgery and things like that. Maybe share just a little bit about your story and the whole, I guess, desire to really want to work with general dentists when it comes to oral surgery.
Well, I went to a good dental school, but still our surgery training wasn't in very much depth, and I felt like I lacked in several areas. But then I went into the Army, and I had a GPR right off. And the first 3 months were in oral surgery, and that's when my life changed. For 3 months, I did so much surgery. There was myself and 3 residents and 3 surgeons. They treated me like a brother in there and taught me to do so much. I didn't go to the operating room and do that sort of thing, but you know, I did so many wisdom teeth and surgical extractions. It was awesome. Mm-hmm. And then when I got out of the Army a few years later, after a couple of years in practice, I felt like I needed more. Yeah. And looked for surgery courses, and there weren't any. I think there was one oral surgeon named Matt Horrigan that was teaching some courses, and I took one from him. But that was about it. And I decided that if no one else was going to do it, based on my experience, I could at least teach something that I learned from the Army experience I had. So I started doing that, and right off, it was very successful.
Yeah. So let's talk a little bit about general dentist and oral surgery and, you know, all of the work that you've done. Why do you feel like general dentists need to know more about oral surgery?
Well, I think what's happening now is that the dental schools are not really consistent at what they're teaching folks as they're graduating, what knowledge they have. Some do a really good job, others not so much. And the bottom line is they just need to know how to take out teeth. Right. And if there's a problem taking out a tooth, they need to know how to take care of it, do business, you know. Sure. That's about it. So my emphasis is on surgical extractions. Yes, we could talk about wisdom teeth and other things, but really it all begins with surgical extractions. Starting to take out a tooth, you have some problems, you know how to resolve those problems, and that is really the basis for anything in surgery that you will do. You learn how to manage soft tissue and hard tissue, you learn anatomy from that, you learn things that will allow you to branch to implants or other surgery things you're interested in.
Mm-hmm. You know, this just hit me. How is it going back in dentistry that when a dentist was trained, did they initially learn, like, I guess, how did specialties and general dentistry even happen? In other words, what is the history of that?
You know, I'm not sure. I knew an oral surgeon once. His name was Dr. Cogswell, and this was like maybe 30 years ago. And I heard that he had been grandfathered in. You know, he didn't go to oral surgery residency program, but I think there were people back at a certain time that general dentists that just did a lot of surgery, and they somehow as a group formed this specialty. Mm-hmm. And then from then on, you know, you would have to go through a program. I remember when I graduated, it was a 3-year program. Now it's a 4, maybe 6, depending on what part of it you get into. Yeah. But and that's great. And we love oral surgeons. We need oral surgeons. They're so great the way they do the various things they do, very sophisticated things. So general dentists don't really ask for that. They just want that little part where they overlap, right, like extractions, sure, to just be able to do that because their patients need it. And a lot of times it's hard to get into a specialist. Or, you know, you're in a public health setting where, you know, the people can't afford a certain level, sure, you know, and they just need someone that can take care of their needs.
Yeah. Is there anything specifically, I know you talked about extractions, but anything specifically in regards to oral surgery that you think general dentists should know?
Well, I think they need to know not to get in over their heads.
Okay.
But, if they weren't trained in anything very much at all, then everything's over their heads,
Right.
which I think is really sad, because I think taking out teeth has always been a part of being a dentist, and being part of it, being a general dentist. So I think we're entitled to a certain level of care that we can provide, which is to take out a tooth that hurts, and then be able to do it in a timely way and in a safe way.
Mm-hmm.
If we can do that, I think we're happy. We don't necessarily need to take out a lot of impactions or do other more sophisticated things, but I think there's certain basic surgical principles that we should know, and that if they don't know, it's been my blessing and my opportunity to be able to teach those basic things.
Sure.
Just to be able to finish the job that you start, and to know things that will enable you to satisfy the patient, and that when you know that basic area of surgery, that if you wanted to, you could go another step and be able to place implants, or you could go further and be able to do other things like incision and drainage, or biopsies, or the really simple things. They're a part of practice. We don't, general dentists won't ever want to do the fancier, like go to the operating room and do orthognathic surgery. That's for those that have had that extra 4 and 6 years of training. But just to do basic oral surgery in a general practice community setting.
Sure. So besides, luxators and skinny burrs, what other methods do you typically recommend?
Well, okay, so when you're taking out a tooth, when implants came along, before implants came along, it was okay to remove the buccal bone, or the bone on the cheek side, in order to get the tooth out, and that was done by oral surgeons, and everyone that knew surgery would do that. They'd remove more bone. With implants came the requirement, though, to not do that anymore, and that was frustrating to the profession when that happened.
Sure.
Because if we take it away, you have to somehow put it back, and that's a costly and a time-consuming process, and involves grafting and all of that. And we didn't want to have to do that in preparation for implants. We wanted to save it in the first place. And so that's when luxators came on, because without even a crown on the tooth, you could take a luxator, and most general dentists have them. Maybe they don't know how to use them as well as they could, but they're basically for when the crown's gone and all there is a root at the level of the bone. Then luxators come in really handy. If you hold it right and use it right, you can work it down the sides of the tooth and get that root out. So with that, though, it's not 100%. It's only maybe 90% successful. What takes it to the next level is that you can take a burr, and we call it a skinny burr. A skinny burr is like the smallest one you can buy, and we take that down the side of the root further than the luxator would go, and then put the luxator maybe now 10 millimeters deep instead of only 4, and as we use that properly, we're able to get it out. So there's elevators, there's forceps, there's the luxator skinny burr combination, and then that's what I talk about, because that is what not everybody knows, and it's it's an effective way. Now, if we go beyond that, then there are other things out there that are good. For example, periotomes. Periotomes are great, and they're minimally traumatic. There's just a little tiny blade that goes down the side of the root like the luxator would have, and the only trouble is it's smaller and you can't put as much pressure on it, so it takes longer.
Right.
So it's not as effective and more time-consuming. There are the double-ended ones, and then there's straight ones that can even be hit with a mallet. The only problem is when you hit them with a mallet, patients don't come back anymore. They hate that. It just rings their head.
Yeah.
So those are a couple of the other ways. There's a device called an autotome, which is a pneumatic periotome, which when you push the pedal, it's like a jackhammer out on the street, and it sounds just like that. It rat-a-tats something down the side. That's good, but it's pricey. Some of these other methods are pricey. There's a piezo. I don't know if you've heard much about the piezos.
Absolutely.
But they're bone-cutting
Yep.
Instruments.
Yep.
The difference there is the burr and the luxator technique. The burr is $2 and the luxator is $50, but the autotome, or the piezo rather, is $5,000 minimum, and they go up to $20,000 from there. And the autotome itself is about $1,400. There's the physics forceps, and we talked about those earlier. Someone did at the course. But those are around $1,000 or so. So the reason I talk about other ways more, and I do mention these ways, and there's even some leverage devices where you put a screw in a root and then you leverage on the screw to get the root out. And those are a couple $1,000s. So that's kind of a cross-section of everything. But the main thing I talk about is the least expensive and still yet very effective way to do it.
Yeah. So I'm very curious, when you look at your career in dentistry and you look ahead, what are a couple of things that you're really excited about? You know, I mean, obviously you're still teaching and giving back, but what are some things you're just excited about?
Well, you know, I don't like the way things are going, where general dentists are doing less and less, because they're being taught less and less. One thing that really excites me is with the group that I'm working with, we have a project to prepare some courses where it would take everything that people need to know about being proficient with surgery, breaking it up into 10 parts, and then having a module that they could study one at a time through the 10, and then be tested on it and accountable for everything that's in that package, so that they can get, mentally anyway, the knowledge that you might get in the first couple months of an oral surgery residency. And then to take that to another level, to work in like a 2 or 3 day course with models and maybe pig's jaws even, to get a better feel for it. And all that culminates then in being able to go to patients, and either in the U.S. with one of us going to their office to work with them one-on-one, or maybe going to the Dominican or somewhere where they could do humanitarian work to help with that aspect of it. And then through that kind of a process to be able to help people get on the level where they'd like to be if they really want to do it.
How about technology? You know, some of the things that are out there that, I mean, you shared a couple of those examples. I mean, technology, as you know, doesn't always have to be the digital X-ray and some of those different, you know, the piezos and things like that you talked about. But what are a couple things that are out there now that weren't out there 5-10 years ago that are exciting?
Well, you never know what's coming next, do you? I mean, these luxators just showed up one day from Sweden, you know?
Yeah.
And then, you know, we use a burr with that sometimes to help it go deeper, but, you know, then they have this piezo that does it without, you know, it just does it very simply and with minimal trauma. So I don't know what's around the corner next. I think I've mentioned most of the ones that I'm aware of, and but there could be something new on the horizon. I'm not sure, and I would certainly be one of the first ones to embrace it when it comes along.
Yeah. Well, it certainly sounds like even just some of the examples that you gave, you know, for those doctors that are not using those and incorporate that in their practice with their patients, you know, could make a big difference.
You know, if they're not using the right instruments, and the right instruments would be those that are used in a training program, like a GPR or an AEGD or a residency. Sometimes I visit a dentist and he says, well, you know, I'm glad you're here because I'm in the middle of an extraction and I'd like you to, you know, pull me through it. And so I sit down and I think, whoa, what are those?
Right,
you know,
right.
It's I don't know, they came from like a couple associates back or something. And so if they had the right instruments, and then And some of these newer ones, depending on what they like, what they can afford, that's what's really needed.
Yeah, interesting. Any last words? Any thoughts on what you're doing or anything? I mean, this has been such great information, and I think I was talking to Steve Parker just about your desire to want to help the general dentist incorporate this for the sake of working with their patients.
Well, I've been around a while, and I don't know how much longer I will be, and I'm in it because of my passion for it. But I realize that in a few years when I'm not doing it, I would like someone else to be able to carry the torch. And so right now I'm trying to recruit some younger folks. Some of them teach in oral surgery programs in dental schools and things like that, because it's not easy to do this. You stand up before a group, and you need to have that enthusiasm, and you need to share the things that they need. You have to be on their level.
Right.
That's a problem sometimes with oral surgeons. They're the best, but they're sometimes either above or below,
Sure.
and not right on where they need to be. So my goal before I leave then would be to help have a few other people that could show up at meetings and do a good job in helping to share principles that are needed for the benefit of the doctors and certainly all their patients.
Yeah, that's awesome. Dr. Koerner, this has been great. I really appreciate it. I think I get this opportunity to spend time and interview people, and it's very inspiring from my side to see somebody like yourself who continues and is continuing to give back to the industry, and I think that's what makes dentistry so great. So it's been a true pleasure to have you on the podcast.
Well, thanks. It's been an honor to be here.
Yeah. All right. Have a great day.